Thank you. So again, general inspection is going to involve looking for any obvious deformities, any redness or swelling of the shoulder, and again, looking for evidence of asymmetry. So then we're going to palpate our bony landmarks. We're going to start with the clavicle where it joins the sternum. We're going to palpate out along until we reach the AC joint, palpate at the AC joint, and then again palpate along the superior aspect of the scapula. Look for any specific tenderness. And we're going to do that again bilaterally. So what I want you to do is hold your arms out to your side at a comfortable position with your thumbs facing out, and then I'm going to have you move them up over your head. But let me move behind you. We're going to do this evaluation bilaterally. So I'm going to ask you to, with the arms in that position, raise your hands up over your head and then bring them back down. And this allows me to do this while seeing what's happening with his shoulders. So now I'm going to move back around in front of you, and we're going to do some strength testing of the supraspinatus. So I want you to put your hand in that same position, sort of out to your side comfortably, which is what we call referred to as the scapular plane. Now what I want you to do is turn your hands down. And I want you to hold them up against resistance, so don't let me push them down. And now we've isolated the abduction strength of the supraspinatus. So now what I'm going to do is isolate the infraspinatus muscle. So I'm going to ask you to hold your elbows at your side with your arms bent at 90 degrees. And again, keep your elbows sort of pressed up against your side, and now rotate your arms outward as far as they'll go for external rotation. Now bring them back in. Now what we want to do is isolate the strength in that muscle. So put your arms in the same position, and now press outward against me. Again, keeping your elbows at your side. All right. So now we've isolated the strength of the infraspinatus. So what I'm going to ask you to do is put your hand up against your belly like this with your elbow out to your side. Now I'm going to try and pull your arm away, and I want you to hold it. All right? All right, so that's testing muscle strength of the subscapularis in the belly press test. So now I'm going to move around behind you. And I want you to take that same hand, and I'll bring it behind your back, and I want you to move it up as far as you can, up behind your back, and scratch as far as you can. All right. Now this one we want to compare side to side. I'm going to ask you to do the same thing with the other arm. All right, thank you. Now let's go back to the arm that's bothering you. So bring that one back, press your hand up against your back. Now I'm going to put my hand against your arm, and I want you to lift it off and press against me against resistance. This is called the lift-off test. Again, for completing strength testing of the subscapularis. All right, so finally what we're going to do is the teres minor. So again, this is using the arm that's bothering you. I want you to bring your arm again sort of out to your side at a comfortable position, about at 90 degrees. Now bend your elbow also for me. Now point your thumb out and backwards, and sort of like try and turn backwards as far as you can. So this is isolating teres minor. This is called the hitchhiker's test. So now we're going to do that with strength. Okay. So what I'm going to do is sort of holding your arm in that same position, I want you to press against this hand, so against resistance. So do the same motion, but against resistance for the hornblower's test. So push against me. All right. So now what we want to do is test for impingement. So I'm going to move your arm for you. So just let me do all of the movements. So I'm going to take the arm and turn it with the arm out at 90 degrees, turn your arm inwards, and push as far as it will go. A positive impingement test for Hawkins impingement test would be pain at that furthest extension. All right, so now we want to test the biceps tendon. So again, we're going to have your arm out slightly forward with your elbow slightly bent and your hand facing up. And I want you to press upwards against my hand. Don't let me push your hand down. So push. All right, positive test here would be weakness in the biceps or pain at the biceps tendon. So finally, to complete the shoulder exam, we want to assess your AC joint. So I'm going to ask you to take this hand and move it across your body and try and pat yourself on the back, completing the exam. And again, a positive test in that location will be pain at the AC joint. So you want to start with a general inspection looking at his posture. Is he standing comfortably? Is he curved to one direction or the other? Can I ask you to take a step forward so I can take a look at your back? I want to do the same thing from the back. Again, looking for, is the spine appear to be center in the midline, or is he curved one direction or the other? You want to always look for the normal curvature of the spine. So you want to look for the convexity in the cervical spine, the concavity in the cervical spine, convexity in the thoracic spine, and then another concavity at the lumbar spine. All right, so now what I'm going to do is palpate the various landmarks. You're going to start with the paraspinal muscles. So you're going to start up here at the base of the shoulders and palpate along the paraspinal muscles all the way down to the sacrum. Again, looking for muscle spasm or any pain or tenderness. Then again, do the same thing for the spinal processes in the center, looking for any evidence of tenderness. All right. So now we're going to talk about range of motion. I'm going to ask you to turn sideways just a little bit for me. So what I'm going to ask you to do is bend forward like you're trying to touch your toes. Now straighten back up. Now bend backwards as far as you can. Now straighten back up. All right, so now we want to test for rotation and lateral bending. But want to make sure that you're doing it primarily from your back and not from your hips. So I'm going to stabilize your hips for you. I'm going to hold on to each hip. So what I want you to do is turn towards your right. Now turn towards your left. All right, now for the lateral bending, try and run your left hand down your side. And now the other direction. All right, thank you. Finally, I want to check for scoliosis. So I'm going to ask you to do is bend forward like you're going to try and touch your toes, and I'm going to look from behind. So I want to get even with his back and see is one side of his back higher than the other, suggesting a curvature of the spine. And you can straighten back up. All right, so I'm going to have you roll towards me. So we're going to be assessing for structures that are best felt with the patient's hip flexed. And again, you're looking for head position. Is he able to look straight forward? Is his head tilted to one direction or the other? Does he appear comfortable? Then you're going to want to move posteriorly to assess your, and to inspect further and to assess your landmarks. So again, looking for the same thing. Is the head appear held steady or centrally? Then you want to palpate along the paraspinal muscles from the base of the skull down to the tops of the shoulders. And again, that's looking for pain or tenderness or any evidence of muscle spasm. Then you're going to want to palpate the area of the spinous processes. Again, from the base of the skull down to the tops of the shoulders. Now we're going to move forward and assess range of motion of the neck. So what I'm going to ask you to do is, for extension, look up towards the ceiling for me. And then look straight and look down as far as you can for flexion. Now I want you to turn your head from side to side, so look towards your right as far as you can, and now look towards your left as far as you can for rotation. And now we're going to go for lateral bending. So I want you, keeping your shoulders steady, tilt your head, your ear towards your shoulder on the one side, and then the opposite direction as well. So I'm going to ask you actually to remove your gown for me. All right, thank you. So again, we want to do a general inspection, looking for evidence of redness, looking for any evidence of asymmetry or obvious deformities. We want to be able to palpate the bony landmarks. So we're going to start with the clavicle. We're going to start with the midline of the clavicle where it attaches to the sternum, palpate out across the clavicle until we reach the acromioclavicular joint, and then palpate along the superior part of the scapula as well. Peripheral palpation. Again, remember doing that on both sides. So now we're going to want to do some range of motion. I'm going to start by asking you to take your arms and raise them up over your head from your sides like this, but I want to look behind you while you're doing it, okay? So I can look at what's happening with the scapula. So if you just raise your hands up sideways over your heads, and thank you, and bring them back down, so I can see the full range of motion and the movement of the scapula at the same time. Now coming back from the front, I'm going to ask you to raise your hands over your head, but from the front. So moving your hands up like this, and bring them back down. And now move them behind you as far as you can. Thank you, and then relax. So now what I want you to do is take your arm and sort of cross it across one direction, and now the same thing for the other arm. All right. So now if there are any abnormalities in that range of motion, I would do it passively. So I'm going to ask you to allow me to move your arm for you. So again, I'm going to lift your arm up over your head and back down, and also want to be able to move to the other side, excuse me, so I can see what's happening with the scapula. So just move your arm up and back down. I'm going to bring your arm forward. And remember to allow me to do the movements for you. And backwards. And now across to the side. Thank you. So now we want to assess for internal and external rotation of the shoulder. So I'm going to ask you to take your arms and put them so your elbows are bent at 90 degrees. All right, and I want you to move your arms outward as far as you can go. And now we want to bring them back in. Problem is that the body is in the way when we try and do that. So what I want you to do is reach around behind you, and how far up your back can you get your arm? All right, thank you, and you can relax. For passive range of motion, for this one, again, bring your arm out. How far out can you get? And then bringing it back in. So now we're going to start with the assessment of the elbow. So for the elbow, you want to make sure you, again, have a full inspection of the elbow so I can see all around it, and again, looking for redness or any obvious deformities. We're going to want to palpate the major landmarks. So for the elbow, that's going to be the medial and lateral epicondyles and the olecranon, looking for pain or tenderness. Finally, we're going to want to look at full range of motion of the elbow. We're going to have him do this in both arms at the same time. So I want you to straighten your arms all the way for me, bend them as far as you can, okay, for both extension and flexion. Now put your hands like this with the elbows bent, keep your palms up. Now turn your palms down and then turn them back up for the assessment of supination and pronation of the elbow. If this was abnormal, now I can assess it passively. So again, just relax your arm and let me do the movements for you. So full flexion, full extension at 90 degrees, pronation and supination. All right, thank you. So now we're going to demonstrate the evaluation of the wrist. So again, you want to inspect the wrist on both surfaces of the wrist, looking for any abnormalities, any swelling or any redness. You want to palpate both the radial and ulnar heads as well as along the joint line of the carpal bones. We're going to want to assess full range of motion of the wrist. If you show me both hands. So I want you to point your fingers towards the sky, point your fingers towards the ground for flexion and extension. Put them straight out for me. Turn your wrists inward and point them outwards for inversion and eversion of the wrist. All right, so now, again, if there's any abnormalities in that, we'll want to do passive range of motion. So just let me move the wrist for you. Moving it full extension. All right, thank you. So now I want to also look at the hand as well. So for the hand, we're going to want to palpate all of the joints in the hand. So again, we've looked at both the dorsal surface and the palmar surface of the hand, looking for any abnormalities. And we're going to palpate all of the joints. There are a lot of joints within the hands and the fingers. So we're going to want to palpate each metacarpal phalangeal joint and then each interphalangeal joint. And we want to get them both laterally as well as anterior-posterior for each individual joint, looking for swelling or tenderness or any bony abnormalities in each joint. Okay, so now we want to do range of motions of the fingers. So if you could turn your hand like this for me. So open your fingers all the way and spread them. Close your fingers for flexion and extension. Open your fingers out and spread your fingers and put your fingers together. We've done general range of motion of the fingers, so now we want to isolate the thumb specifically. So we want to take your thumb and just follow my movements for you. So you've got your thumb pressed against the hands, that's adduction. If you can move your finger out, that's abduction. You can bend your thumb this way, that's flexion. Straighten it out, that's extension. And now move your thumb across your hand to your pinky for opposition. Thank you.
Good morning, I'm Dr. Mona. Can I examine you? Start your examination by inspecting the upper limb for the presence of scars, deformity, any wasting or fasciculation by tapping over the muscles. Ask about pain and start testing the tone. Any pain? Okay, I'm going to move your limb. If you feel any pain, please tell me. Start tone by checking for circumduction of the shoulder. Flexion, extension of the elbow. Then circumduction of the wrist. By this, we check the tone around the shoulder, elbow, and wrist. Then, moving to the power. Check the power of the shoulder joint. Flexion, push me up. Push me down, please. Push me up. Push me down. Abduction, push me out. And adduction, push me in. Thank you. Power around the elbow, tested by flexion, push me in, push me out. And extension of the elbow. Push me in, out please. Then power around the wrist by checking flexion and extension of the wrist. Close your fist, push me down, up. Down please, up please. Checking the hand grip for delayed relaxation of hand grip to diagnose myotonia if it is present. Would you release your head? After this, moving to the next part of our examination, which is reflexes. Biceps, brachioradialis, and triceps reflex. I'm going to tap over your tendon. It will not hurt you. Put the upper limb in 120 degree. Press over the biceps tendon. Look to the muscle and tap. Same here, 120 degree. Expose the muscle. Press over the tendon and tap. The brachioradialis tested also in 120 degree by putting fingers over the brachioradialis tendon and checking the reflex. Triceps on 90 degree. Support by the wrist. Support the wrist. Check for the triceps reflex. After you finish the reflexes, check for Hoffman sign, which is the surest clinical sign of upper motor neuron lesion in the upper limb. If it is positive, there will be flexion of the index and thumb on nipping of the middle finger. Thank you. After this, you have to test for cerebellar function. It is tested by either finger to nose, finger to finger, finger to doctor test. So I'm going to check for finger to doctor. Please touch my finger with yours. Then touch your nose. Okay, the other hand. Touch your nose. Would you please touch your fingers together? Again with closed eye. Thank you. Moving to the third part of our examination, which is checking the sensation. We start by fine touch. Can you feel?
Yes.
Same?
Yes.
Would you close your eye, please? Can you feel?
Yes.
Same as above? Yes?
Yes.
Can you feel?
Yes.
Okay. Same?
Yes.
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 Okay, thank you. Checking for pinprick sensation. Can you feel this?
Yes.
Yes. Can you feel this prick?
Yes.
Yes. Would you close your eye, please? Can you feel this?
Yes.
Same like above? Yes.
Yes.
Can you feel this?
Yes.
Same?
Yes.
Can you feel this?
Yes.
Same?
Yes.
Same? Okay,
Yes.
thank you. Then the deep sensation checked by vibration sense and joint position. Activate the tuning fork. Can you
Yes.
feel this?
Yes.
Is it vibration?
Yes.
Same?
Yes.
Okay, close your eye. Start by the base of the thumb.
Yes.
The same like above?
Yes.
Close your eye.
Yes.
Same like above?
Yes.
Okay. If you couldn't feel the vibration, you start moving the tuning fork from the base of the thumb, styloid process, olecranon, acromion, clavicle, mastoid, till he feels. Lastly is joint position. Demonstrate first the position of his joint. This is up, this is down. Would you please close your eye? Where it is? Down, yes.
Yes.
Up or down?
No.
Perfect.
As we look at Levi, take your hands out like this. You'll see that the station of his hand, this is a valgus, it's a normal valgus. We look at his shoulder girdle, this is normal. Landmarks, they're doing great. Now for the simple part of the exam. Levi, you're going to do exactly what I tell you to do. Okay? I want you to take your hand, bring it up over your head, just like this. Go like this, and go like this. Put it down by your side. Same thing with the other shoulder. The other hand, like this, and behind your back. Okay. Then put your arms down by your side again. Go like this. Press hard. Notice these guys get big. Put them down. Bring your arms up. Bring your arms down. Put your hands like this. Roll them in. Roll them out. Fingers open like this. Okay. Now, I want you to pretend like you're hammering. So again, go like this. Hard. And let's do it with the other hand. Now I want you to turn to your side here just so the camera will see. And I want you to pretend like you're throwing a spear. Okay. Same thing. And do it with the other hand. Did any of that hurt you?
No.
We have a sensory area, the deltoid, right here. Levi, do you feel that?
Yeah.
We have a motor, the deltoid. Levi, hold that right there. Don't let me move it. I can palpate the deltoid. Put your arm down by your side. And we have a specific reflex, the biceps reflex. And I can use a reflex hammer, or in this case, I can elicit it with tapping of my fingers. That was C5. Now C6. Do we have a sensory area for C6? Yes. Make a letter 6 just like this. And this is C6. That's the sensory area. The motor for C6 is the biceps muscle. So hold it right there. And the reflex for C6 is a brachioradialis, right here. Now we'll go to C7. In C7, our sensory area is middle finger, middle finger. The motor area of C7 is the triceps. Push against me. Boom. And finger extension. Just go like that. Against resistance. Okay? And relax. Now, there is a reflex for C7, and that's the triceps tendon. So now we've gone through C5, C6, C7. C8 and T1 do not have a reflex, but they do have a sensory area. Okay? C8 sensory area is the small and the ring fingers, the forearm. Spread your fingers apart, bring them together. Finger flexors and the intrinsics, spread your fingers apart, bring them together this way. Okay? And the same with T1. Interossei, hold it together. Relax now. Okay? And the sensory area for T1 is the inside of the arm. We look for the common landmarks. Those common landmarks consist of the trapezium, the clavicle, the spine of the scapula into the acromion. You can palpate a bony prominence right here. That's called the cornoid. We look at the definition of muscle, which is the deltoid. And I can start by just doing surface anatomy. Surface anatomy being, Levi, do you feel me right here?
Yeah.
Okay. So we've got that sensory area for C5. Now, Levi, I want you to bring your shoulder, and we're going to go into external rotation. I'm going to turn you this way. Internal rotation. Abduction. Adduction, adduction. Okay. Forward flexion and extension. I put my hand on the shoulder and I feel the glide of the humerus with the scapula, the glenoid. It's smooth, nice, smooth glide. And you also notice that as I do this, there is no apprehension. There's no sense that there's instability of the shoulder, which you would see commonly in a loose shoulder or an unstable shoulder. Now, in this area, as we drop down into and head towards the elbow, there's a couple things that we can do very quickly. One is hold your arm right there. Don't let me move this. Boom. On the same token, I'm going to put your arm there and I'm going to push up. Don't let me move that. Now, I think one of the easiest things in motor examinations, which you just saw, was placing the motor in the position that you want it and having the patient hold it, as opposed to telling the patient to move it for you. We've already seen that in the first segments, and Levi, just relax now. Okay. Telling Levi to bend his elbow and extend his elbow is okay, but this is actually much quicker if you just say, hold it right there, don't let me move it. And that tests his biceps. Put your elbow right there, don't let me move it. And his resistance to me tests his triceps. Same token, if I take his shoulders and put it off to his side like this, say, don't let me move it, and doing it like that, I've tested his deltoid. Now, Levi, put your arms by your side, just on your hips, and press in. And this is a nice way to examine for pecs and for latissimus. In little babies, in newborns, If you reach inside and you're looking for the presence of a pectoralis major and latissimus, even if you squeeze up underneath there, they'll contract down and you'll be able to palpate that.
Just kind of pretend that we've already cleared the chest, cleared the upper arm area, and demonstrate the light skin tractioning massage on the forearm here. So if I were trying to clear the forearm, I would be working proximally to distally, and you just lay your hand over the extremity, try to get a lot of contact area, but very little pressure. And then once you've done that, you just traction the skin distally, kind of come across, and then let it retract proximally. So you're doing kind of a U shape. And you would do 5 of those light skin tractioning U's right in a row as you clear. First you're going to do about the proximal third of this segment, the segment here being the forearm. And then you'll move to the middle and do 5 more in the middle of that segment. And then move distally and do 5 more on the distal part of that segment. Again, I'm just trying to get a lot of contact area with my hand on this extremity, but very little pressure, just enough so that I actually will traction the skin instead of slide over it. So now I have cleared the forearm, and I could clear the forearm on the back as well. And then the next thing I might do is to try to flow that edema through the lymphatic system proximally. When you do your flowing skin tractioning massage, it's basically the same technique, just get a lot of contact area, very little pressure, and you do the little U, and then you'll move to the middle, and then proximally up the arm, across the chest, and you'll do that flow 5 times. The other technique I want to demonstrate with manual edema mobilization is the pump point stimulation. This is done in areas where the lymph tends to slow down a little bit, typically around lymph nodes. And so like there's lymph nodes in the medial elbow, and so for the pump point stimulation, you're going to lay your hand on that, and typically we'll do both sides at once with pump point stimulation. You're going to do that same skin tractioning massage with maybe just a little bit more pressure over the pump points, and you'll do a lot more repetitions, maybe 20 or 30 repetitions over the pump points. You can do that after you've cleared and flowed, or you can do that between clearing and flowing, but that's just there to try to stimulate a little bit quicker flow through those areas where the lymph tends to otherwise slow down a little bit.
We have finished the cranial nerves. We'll move to examination of the motor system. We'll test the power of the muscles, and we'll test tone, and get a conclusion about whether they are normal or not. It's wise to remind you at this stage that the muscle strength has 5 grades. Grade 0, where there is no movement. Grade 1, flicker of movement. Grade 2, movement with gravity removed. 3, movement against gravity. 4, movement against resistance. And 5 is normal power. Testing the tone of the upper limb, for example, is like so. You hold the hand in your hand, and you support the elbow, and then you do this movement. This will show you whether he has any normal tone or hypotonia or increased tone. And we'll do the same with the other limb. Sometimes in extrapyramidal lesions, you try to do this also movement to test for that one. So we can do it either in the elbow or in the wrist or in both. After the tone, we have to test the muscle power. So we will start by the shoulders, and we'll test the deltoid. So put your hands like this, arms like this, and then I'll push down, you push up. So the deltoid is good. So thank you. And now I'll hold his hand like this. I put my hand on his shoulder and ask him to bend his upper limb. bend. This is testing the biceps, which is good. Now I'll just move like this and ask him to push away. So this is, I'm testing the triceps. Now, while I'm at the same position, I take his hand, leave it please, and rotate it a little bit so I can test. See, it was like this when I tested the biceps. Now I'll do like this to test the brachioradialis. Pull towards you, and you can see the brachioradialis coming quite nicely. So, after finishing testing the muscles of the shoulder and the muscle of the elbow, we come to the hand. The first thing is to ask him to make a grip, and then try, don't resist me. Don't let me do anything. I will try to bend it, so I can't. I try to extend it, I can't. So the muscles of the wrist are good. Then I'll put my fingers inside there and ask him to squeeze, and then I try to push so that I pull my fingers out. Usually I shouldn't be able to do this. Then I look at his hand and look at the muscles, mainly these muscles. The first dorsal interosseous. Usually it should be up and bulky, and if there is a concavity here, then one is looking at atrophy of the muscles or small muscles of the hand, and with its significance. Then I come to test the abduction and adduction of the fingers, and usually I hold his hand like this and ask him to push his fingers apart. So he's pushing quite hardly. Now to test the abduction, what I need is to bring a piece of paper and put it inside between his fingers, and like this, and hold it with your fingers, and I try to pull. I can't pull it. If you want to test the adductor of the thumb, you place it here and ask, not with the tip, just with this. Hold it open first. Let me put it now, and it's quite good. Thank you. I'll take it. So
support the elbow and just passively move the fingers, passively move the wrist, passively move the elbow, and passively move the shoulder. Remember, I'll be watching you. You should be doing both sides. You lose points because you do only one side and you forget about it, so you have to do the other side also. Support the elbow, passively move the fingers, passively move the wrist, passively. Tell the patient, relax please. Passively move the wrist, elbow, and put the shoulder through a moderate range of movement. Same thing, another way to do it is to hold both the wrists up and just let the wrist fall down. See, this is normal. If there is decreased tone, that side wrist will be lower down. And move the joints and see, it's normal. So this is tone. Examination of tone of the upper limb, examination of tone of the lower limb. Let's start with the upper limb. Start.
0.
You have to do the shoulder, you have to do the elbow, you have to do the wrist, and you have to do the fingers. So shoulder strength, bicep strength, tricep strength, wrist, dorsiflexion, grip strength. Then I'm going to demonstrate the leg. So please extend your hand against my resistance. No, give resistance. This is how you test for shoulder.
I'm weak, sir.
Good, that's fine, that's fine. So you're tested for deltoid. Similarly, again I'm repeating, don't forget to test the opposite side. Many of you do forget and you lose points. Next, I'll ask you to flex your elbow and I'll give resistance. So flex it tightly.
Oh my god. I'm getting pulled off a desk.
Against resistance. Now straighten your hand, try to straighten your hand against resistance. Keep it flexed, keep it flexed. Flex it, now try to straighten it. Give resistance. So biceps, triceps. Next, dorsiflexion of the wrist. Look at the picture very carefully. Next slide. Dorsiflexion should be with the hand closed. Why? Because we don't want them to use the extensor digitorum. So the wrist should be in the flex position. And so please make a fist and try to straighten the wrist against resistance. So this test for dorsiflexion of the wrist. So you're supposed to ask the patient to make a fist. Move it up, move move it up. And no, let me bring you down. This is dorsiflexion of the wrist. So we will watch you whether you ask the patient to make a fist and whether you are giving resistance. Don't keep it open because otherwise he'll use the extensor digitorum also. So here you're testing for the extensor carpi radialis, longus brevis, and ulnaris. Similarly on the other side, please make a fist. Yes, and you try to give resistance. Last one, grip strength. Now watch very carefully. Don't keep your fingers straight next to each other. Why? Sometimes the patient is so strong that they will crush your finger. Always keep one finger over the other finger. We will watch this. Please try to hold my fingers as tightly as you can. You can do both simultaneously. And watch for strength. And with your thumb, just keep holding me. With your thumb, try to remove your finger. This is testing for.
देखना होता है कि जहाँ सबसे ज़्यादा ये है आपका मसल, ठीक है, कोई भी एक पॉइंट आप फिक्स कर लेते हैं, ठीक है, जिस तरह देखिए कोई भी मिड आप पॉइंट मसल का देख लें यहाँ से, फिर वो कंपेयर कर लें, दोनों साइड कंपेयर करनी होती हैं, इसी तरह थाई का, ठीक है, और आप लेग का भी देख सकते हैं इसी तरह, कोई एक पॉइंट और दोनों वही एग्जैक्ट पॉइंट होने चाहिए ताकि दोनों तरफ से कंपैरिजन कर सकें हम। ढीला छोड़ देना है, ठीक है, जो इनकी रिस्ट है, ये कलाई है, इन्होंने अपने इसको एक्सटेंड करना है, ठीक है, उसके बाद हम टोन चेक करेंगे मसल की, ये और इनकी एक नॉर्मल टोन ऑफ मसल हमें फील हो रही है। इसी तरह हम दूसरे बाजू पे बाजू की ढीला छोड़ दें और अपनी कलाई इस तरह ये देखें, ये टोन ऑफ मसल नॉर्मल शो कर रही है हमें। इसी तरह आप इनके थाइस की भी चेक कर सकते हैं, लेकिन मोस्ट स्पेसिफिकली हमने ये स्टार्ट। ओके, इन मसल पावर वी विल स्टार्ट फ्रॉम ओपोनेंस पॉलिसिस, ठीक है। अच्छा, ऐसा है कि मैं आपने ये करना है कि अपना ये थंब जो है ये अपनी लिटिल फिंगर, छोटे फिंगर की तरफ लेके जाना है, ठीक है। मैं अपनी फिंगर से इसको रजिस्ट करूँगा, मैं देखिए अब मैं इस तरफ जोर लगाऊंगा, आपने इस तरफ जोर लगाना है, ठीक है। जिससे आपकी ये इसकी पावर चेक होगी थंब की, ठीक है। चलें, आप इस तरफ करें, इसको साधना है, ठीक है। इनकी मसल पावर ओपोनेंस पॉलिसिस की बिल्कुल ठीक है। ओके, नाउ वी विल चेक इंट्रोशियाई मसल्स ऑफ फिंगर। ऐसा है कि मैं आपको ये कार्ड पकड़ाऊंगा आपके दोनों फिंगर के दरमियान, ठीक है। आपने इसको अच्छी तरह होल्ड करना है, पकड़ना है, ठीक है, और मैं इसको आपकी तरफ खींचूंगा, इससे आपके दोनों मसल्स ये उंगली की दोनों मसल चेक होंगे, ठीक है। चलिए स्टार्ट करते हैं, पकड़ें इसको। ये देखिए मैं अपनी तरफ खींच रहा हूँ, लेकिन इन्होंने बड़ी अच्छी फॉर्म इनकी है, और ये इट मीन्स कि इनकी इंट्रोशियाई मसल्स की पावर बिल्कुल ठीक है, नॉर्मल है। ओके, आफ्टर इंट्रोशियाई मसल वी विल स्टार्ट फ्रॉम फ्लेक्सर्स ऑफ फिंगर्स। अच्छा, फ्लेक्सर ऑफ फिंगर्स की हमने बेसिकली अपने सब्जेक्ट से ये कहना है कि मैं आपको ये अपनी फिंगर्स आपके हाथ में इस तरह रखूँगा, ठीक है। आपने अपनी ज़ोर से इसको पकड़ना है, मैं अपनी फिंगर्स खींचूँगा, लेकिन आपने इसको पकड़ के रखना है, ठीक है। इससे आपके ये फ्लेक्सर्स ऑफ फिंगर्स पता चलेंगे। पकड़ें, ओके। फ्लेक्सर ऑफ फिंगर ऑफ माई सब्जेक्ट इज़ नॉर्मल। ओके, आफ्टर फ्लेक्सर्स ऑफ फिंगर्स वी विल चेक फ्लेक्सर्स ऑफ रिस्ट। अच्छा, फ्लेक्सर ऑफ रिस्ट के लिए बेसिकली हमें अपने सब्जेक्ट को ये कहना है कि इन्होंने अपनी फिंगर्स जो है अपने फोर आर्म की तरफ मूव करनी है और मैंने रेजिस्ट करना है, ठीक है। ऐसा है कि ये आप अपनी इसकी तरफ मूव करेंगे, ठीक है, और मैं इसको रेजिस्ट करूँगा, ठीक है। चलें स्टार्ट करते हैं। ओके, ये देखें, मतलब कि इनकी जो है फ्लेक्सर ऑफ रिस्ट जो बिल्कुल नॉर्मल इनकी ग्रिप है, ये नॉर्मल हम कंसिडर करेंगे। ओके, आफ्टर चेकिंग फ्लेक्सर्स ऑफ रिस्ट we will start from extensors of wrist. Okay, in extensor of wrist I will ask my subject to make a fist. ऐसा है कि आपने ये मुट्ठी बनानी है, ठीक है। ये देखें, ये बिल्कुल नॉर्मल इनकी ग्रिप है, ये इनके एक्सटेंसर ऑफ रिस्ट हमने चेक कर लिया, ये नॉर्मल है, ठीक है। ओके, वी विल स्टार्ट फ्रॉम बाइसेप्स नाउ, ठीक है। अच्छा, आपका ये मसल चेक करना है हमने, ठीक है। ऐसा है कि आपने ये जो है ना आप जोर इस तरफ लगाना है, ठीक है, और मैं आपका इस तरफ लगाऊंगा, आपने पूरा इसकी तरफ मूव करनी है और मैं इसको आपको रजिस्ट करूँगा, ठीक है। ये चेक करते हैं, चलें। ओके, इनका बाइसेप मसल बिल्कुल नॉर्मल है, अच्छी पावर है, बाइसेप मसल पावर बिल्कुल नॉर्मल है। ओके आफ्टर बाइसेप वी विल चेक इट्स ट्राइसेप मसल, ठीक है। ट्राइसेप मसल के लिए आपको ऐसा है कि आप अपने बाजू अपना सीधा करना है, ठीक है, और मैं जोर लगाऊंगा इस तरफ, ठीक है। आपने अपने बाजू सीधा करने की कोशिश करनी है, ठीक है। इससे आपका ये मसल चेक होगा। चलिए आप स्टार्ट करते हैं। ये देखें, ये इनका ट्राइसेप मसल नॉर्मल है, इन्होंने अब रेजिस्ट अगेंस्ट रेजिस्टेंस नॉर्मल इनकी मसल पावर है। अच्छा, ऐसे अब सुप्रास्पाइनेटस मसल और डेल्टॉइड मसल हम चेक करेंगे। उसका तरीका ये है कि आपने अपने बाजू ऊपर लेके जाने हैं, ठीक है, इस तरह। तो मैंने जोर लगाने हैं नीचे को, ठीक है। इससे आपके डेल्टॉइड मसल और सुप्रास्पाइनेटस मसल चेक होंगे, ठीक है। आप जोर लगाएं नीचे को। ओके, इनका सुप्रास्पाइनेटस और डेल्टॉइड मसल चेक किए, मसल पावर बिल्कुल नॉर्मल है। अब ये है कि इसका हमने देखना है एब्डोमिनल मसल की पावर चेक करनी है। उसके लिए मैं अपने सब्जेक्ट से ये कहूँगा कि